All right, so good afternoon. Thanks for joining us. For today's presentation, our Lunch and Learn series with the Pikes Peak Library District. Today, we're going to talk about Medicare enrollment periods, solely and specifically. If I will be more than happy to take questions during the presentation, since we were such a small group. And after the presentation, this should be a short presentation with some basic information. So please feel free to ask a question by simply either unmuting, or you're always welcome to type your question into the chat box. I did send out an email to all registrants that included the slides for today's presentation so that you have those for your reference. So let's go ahead and get started. So again, this is the Lunch and Learn series in partnership with the Pikes Peak Library District. And we've enjoyed participation with the Library District for many years now. So we appreciate their partnership with us. I am with the Pikes Peak Area Council on Governments Area Agency on Aging. The mission of the Area Agency on Aging is to work with partner communities and local governments to develop processes and systems that allow people to stay in their homes for as long as possible. The Area Agency on Aging in Colorado Springs here serves a total of 3 counties: El Paso, Park, and Teller. I am the coordinator for the SHIP program here in Colorado Springs, which is the State Health Insurance Assistance Program through the Area Agency on Aging. The State Health Insurance Assistance Program is a federally funded program that's designed to provide free and unbiased information and education on all things Medicare to anybody who's interested in that information. So we are able to provide assistance and information and education on all parts of Medicare, all types of insurance that could go potentially with Medicare. And we also assist people who are on limited or low income applying for financial assistance for Medicare. The SHIP program out of Colorado Springs office serves a total of 9 counties in Colorado, which I've listed on the slide. Every county and every state in this country has access to a SHIP program, if nothing else by toll-free statewide number. I've listed on this slide both our local Colorado Springs number as well as our statewide toll-free number. So again, today we're going to be talking about Medicare enrollment periods, and there are many, many of them to talk about. So we're going to talk about the initial enrollment period for when people are initially becoming eligible for Medicare, any special enrollment periods, the annual general enrollment period, which is also referred to as open enrollment, the newest enrollment period, which is the annual Medicare Advantage open enrollment period, and then we're also going to touch on the general enrollment period for enrolling in Medicare. So we're going to start with the initial enrollment period. The initial enrollment period typically refers to enrolling in original Medicare A and B for those people who are just becoming eligible for Medicare, whether that's based on turning 65 or whether it's based on becoming eligible for Medicare due to disability, which can be at any age. These days, many, many people are working past age 65 when their initial enrollment period would be. And so what people need to understand is you don't have to be retired to enroll in Medicare. On the other hand, if you are continuing to work and you have employer coverage through that work, you don't necessarily have to enroll in Medicare either. The initial enrollment is a 7-month window, which for most people will surround their 65th birthday, or for people under 65, their initial month of eligibility. That 7-month window begins 3 months prior to the month of the 65th birthday or month of eligibility, the month of, and up to 3 months after the month of someone's 65th birthday or month of initial eligibility. That 7-month window is considered the initial enrollment period. and you can enroll in Medicare at any time during those 7 months. What you should understand, though, is that if you enroll anytime in the 3 months prior to that 65th birthday or month of eligibility, Medicare would begin that month of your 65th birthday or eligibility. If you enroll during the month of or any of the 3 months after that, there will be a delay of 2 or 3 months before Medicare actually starts based on that later in the period enrollment. If you do not enroll during initial eligibility, during this initial enrollment period, it is possible, unless there are other circumstances, that if you wait to enroll until another enrollment period, there could potentially be penalties for late enrollment, and we will talk about that in more detail. If you don't enroll in Medicare when you are first eligible or you are turning 65, Social Security basically only allows one good excuse for that. And that's if you are actually either continuing employment with employer group health coverage, or you're the spouse of someone who's actively employed and you're covered under their employer group health coverage. That is really the only good excuse Social Security will allow for not enrolling during initial eligibility. If you are in that situation where you have coverage through active employment, either your own or a spouse's, Medicare and Social Security will allow you to enroll in Medicare at any point past your initial eligibility while you're still working. So whether you are working and you delay a year or a month, you're able to enroll in Medicare at any point while you're still actively working and have that employer group coverage. Once that employment ends and that employer group coverage ends from active employment, you also get an additional extended amount of time to enroll in Medicare without penalty. So if you are continuing to work past initial eligibility, say you work another 2 years, you decide to retire after 2 years, once you actually are no longer employed, you actually have an 8-month window to enroll in Medicare without penalty from that point forward. This is referred to as a special enrollment period. There are some rules around how large that employer has to be in order to fall under this special enrollment period. So for example, if you are working for a large employer of 20 or more employees with employer group health coverage, if you're 65, if you're under 65, it would have to be an employer of 100 or more employees to qualify. If for some reason you didn't enroll during initial enrollment and you weren't actively employed between the time you became eligible and the time you enroll in Medicare, typically your only other opportunity to enroll in Medicare would be during the annual general enrollment period. The annual general enrollment period allows anybody to enroll in Medicare between January 1st and March 31st of each year. Typically, if you are enrolling during that time frame because you didn't enroll based on the other 2 opportunities, coverage doesn't start until July 1st of that year. So there's an extra delay in effective date. That has always been the case, but there is potentially a rule change to that starting next year, where Medicare is not going to make people wait until July anymore. If you enroll between January 1st and March 31st, your coverage should start the first of the following month. Whether or not that rule is implemented or not, starting in January, we have to wait and see, but it is scheduled to change in that regards. If you're enrolling during this general enrollment period of January 1st to March 31st because you missed the other 2 opportunities, you are looking at having to pay a potentially higher premium for Medicare based on late enrollment. And again, that penalty that we've talked about in our Medicare 101 presentations is going to be 12 or 10% for every 12 months that you were past initial enrollment, but did not have employer group coverage. So for every year you delay enrolling in Medicare without those other 2 situations, you're looking at paying an extra 10% on your Medicare premiums as a penalty every month forever, penalties never ever go away once they're imposed with Medicare. Once you're enrolled in Medicare, there are a couple of enrollment periods to be aware of as well. For people on Medicare, there is the annual election period, also referred to as open enrollment. That's usually what we call it, is just open enrollment. And that is the enrollment period that is October 15th through December 7th every year. During this enrollment period, people who have Medicare are able to either enroll into a Medicare Advantage plan or standalone prescription drug plan, or they're able to disenroll from an Advantage plan or prescription drug plan, or they're allowed to switch from one of those plans to another plan. Any change somebody makes during this October 15th through December 7th window goes into effect automatically January 1st of the next year. So again, in the annual open enrollment period of October 15th through December 7th, you're allowed to either get into, get out of, or switch from one Advantage plan or Part D drug plan to another. And that change goes into effect January 1st. We do always strongly encourage people to take advantage of this annual enrollment period, especially if you are purchasing or have a standalone Part D plan, to make sure that you have the best drug coverage available to you every year, because plans change, costs change, drug lists change, your needs change. And so it's always encouraged that you take advantage of this annual enrollment period to make sure that whatever plan you have is going to save you the most money for the next year. I do see a question in the chat box. If enrolling in the birth month, say of December, will Medicare start in January? No. If you enroll in the month you become eligible for Medicare or the month you turn 65, your coverage will start in February. So there will be a 1 month delay. If you enroll in the month after your birthday, there's a 2 month delay, so on and so forth. So the longer you wait, the longer the potential delay in your effective date for Medicare. If you enroll anytime during the 3 months prior to that month of eligibility, your coverage starts the month of eligibility, the month you turn 65. And then the last enrollment period we're going to talk about is the newest enrollment period available through Medicare. This is also an enrollment period for people who are already enrolled in Medicare. And this is the Medicare Advantage Plan open enrollment period. This enrollment period is also a January 1st through March 31st timeframe. Any change you make during this period goes into effect the first day of the next month that you make that change. But this enrollment period only applies to people who, as of January 1st in any given year, are actually enrolled in an Advantage plan. They have this additional 3 month window to either change from the Advantage plan they have to a different Advantage plan, or get out of an Advantage plan altogether and go back to original Medicare and a separate Part D. If someone is not enrolled in an Advantage plan on January 1st of any given year, this enrollment period does not apply to them. So it only applies to people who are in an Advantage plan on January 1st of any year. And again, it only allows them to change to a different plan or get out of Advantage plans altogether and go back to original Medicare. So that is a brief overview of all of the Advantage plans that are available to enroll in Medicare or once you have Medicare. This honestly does not cover all scenarios, and Medicare always has special opportunities for people to make plan changes or enrollment changes based on other situations. But these are the main enrollment periods that people need to be aware of when they're becoming eligible for Medicare or once they've enrolled in Medicare for the first time. Are there any other questions about any of this information? I can tell you for a more detailed explanation of all of these enrollment periods, I also do a 4-part, 4-week Medicare 101 series. where we're able to dive much, much deeper into all of this information, as well as more information about Medicare in general, such as benefits coverage and costs, what Advantage plans cover and don't cover, and how they work, and supplements and Part D and all of that. And you're always welcome to attend any of our free presentations. We also record all of our presentations, and they're available for you to view at your convenience from our website. Anyone who registers for our presentations also gets an email the next day that has a link to the recorded session from for the presentation that they registered for. So again, I'm going to see if there's any questions. If you have questions, you can simply unmute and ask your question, or you're always welcome to type it into the chat box. Again, I am with the SHIP program. The SHIP program is always available to answer any and all questions anybody might have regarding Medicare in any way, shape, or form. We don't sell anything. We don't endorse any specific insurance products or companies. We are true consumer advocates and can provide one-on-one counseling and education on Medicare for anybody's individual situation. So we can truly look at a person's individual circumstances and help them understand what options are going to best meet those needs. If you wanted more information about the SHIP program in general, I have listed the national website, the shiptacenter.org. It's also a good site to get information about volunteering for the SHIP program. Again, this is a federally funded program. We do not charge for our services. So of course, volunteers are always welcome and encouraged. Our office is also, as a SHIP program here in El Paso County, we are also the Senior Medicare Patrol Office, which is another part of the SHIP program, which focuses on Medicare fraud and abuse and education. So that program is also always looking for volunteers to educate the public about how to avoid being a victim of fraud and abuse and how to spot fraud and abuse. I've also listed the national website for that program. And again, we're always looking for volunteers. That's actually one of the funner things to volunteer for under the SHIP program. So that concludes our presentation for today. I do have another question. Para-retiree whose husband turned 65 in December. He'll start his transition process in October. Any other considerations we need to know about? I can tell you that para-retirees are given very, very good options for coverage to go with Medicare once they become eligible. And I can tell you if that you use the Paracare system now, your costs do go down when you become eligible for Medicare and continue with that Paracare coverage. If you intend to use the Paracare retiree benefits that are designed to coordinate with Medicare, I can tell you that you will not need to worry about looking at purchasing anything else, because that coverage will include drug benefit that is considered better than what Medicare offers under Part D, as well as includes very good benefits that coordinate with Medicare. So you wouldn't need to look at any other products or coverages to go with your Medicare if you chose to go with the Paracare option. So hopefully that answers that question. Any other questions? It doesn't have to necessarily be about open enrollment or annual enrollments. All right, well, with that, I will conclude today's presentation. Again, I really appreciate you joining us this afternoon. Hopefully this has been helpful and informative. If you do have other questions down the road, you're always welcome to contact us by phone or by email. There's our local, again, our local Colorado Springs office, as well as our toll-free statewide number. If you call the toll-free statewide number, it'll route you to the SHIP office closest to where you're calling from. And again, that applies to any state in the country. We currently have our 5 full-time counselors to assist you and a couple of volunteers. I'm always available by email, or you're always welcome to call us for more information or to answer any other questions. So with that, I will let you all go. Stay warm, stay safe, and hopefully I will see you again for a future presentation.
Thank you.
Good afternoon. Thank you.